eye cancer, alcoholism, eye color helps us stand out, but it can also forecast our future health. Here's what scientific studies say about blue eyes and their connection to melanoma and other serious health conditions. Eye color is one of those things that makes us somewhat unique, especially if you have a hue that's not common where you live. People often comment on it, compliment it, and ask you questions about whether or not your parents have the same shade.
You have beautiful eyes.
As it turns out, a variation in your genes does have everything to do with it. The shade itself is dependent on just how much melanin is present in the front layers of your iris. Those with more melanin exhibit darker hues like brown, while those with less end up with lighter shades like blue and green. Interestingly, according to a survey of 1,000 people by 1-800-CONTACTS, blue eyes are typically associated with confidence and expressiveness. Research published in the Journal of Pain also indicates that people with blue eyes tolerate pain better. Having blue eyes may also be an indicator of the state of your future health. For instance, people with blue eyes may be at greater risk for age-related macular degeneration, according to a 2000 study published in Transactions of the American Ophthalmological Society. This might be because those with lighter-hued eyes are more sensitive to UV light exposure. Continued UV light absorption can lead to eye damage and even vision loss. If you have blue peepers, you're more prone to getting a type of cancer called uveal melanoma, at least when compared with your brown-eyed friends, according to a 2020 study published in the International Journal of Molecular Sciences. Also known as intraocular or ocular melanoma, uveal melanoma is pretty rare. Only 5 people in a million get it, according to the UPMC Hillman Cancer Center. In the US, about 2,500 people are diagnosed with it yearly. As the name suggests, it affects the uvea, the middle layer of your eye. Other factors that put one at risk of this particular type of cancer include skin color, having freckles, and being older.
You just feel like your whole world has been shaken.
This surprising side effect of having blue eyes may also have to do with increased sensitivity to UV light, although the science on that isn't very clear. Nevertheless, it won't hurt to protect your peepers by investing in a good pair of sunglasses, one that blocks most UVA and UVB light. A 2011 study in the Mediterranean region found that blue eyes and fairer skin were risk factors for type 1 diabetes. T1D, which is an autoimmune reaction, occurs when your pancreas produces very little or no insulin. Symptoms of this health condition include feeling thirsty often, excessive hunger, an increase in urination frequency, unexplainable weight loss, mood swings, fatigue, and blurred vision.
It's a full-time job that you can't quit, a massive burden that you didn't ask for.
T1D is rarer than type 2 diabetes, but can be treated by maintaining healthy blood sugar levels, making healthy food choices, exercising, and working with your healthcare provider. One big health problem connected to having blue eyes actually has to do with your drinking habits. According to a 2015 study published in the American Journal of Medical Genetics, those with lighter shaded irises may be more prone to alcohol dependence than their brown-eyed peers. Although there are no definitive theories laid out as to why this might be, one idea suggests that people with darker eyes might be more sensitive to the effects of alcohol, which could be preventing them from consuming enough to become dependent on the stuff. Apparently, the same cannot be said about their blue-eyed friends. Alcoholism is related to many short-term risks like road accidents, injuries, behavior changes, and miscarriages. Long-term effects include alcohol use disorder, depression and anxiety, memory issues, a weak immune system, cancer, and other serious health concerns, according to the Centers for Disease Control and Prevention. Endometriosis is a condition of the womb. Deep, infiltrating endometriosis is both a rare and more serious form of endometriosis, where tissue that's supposed to be inside your uterus grows outside of it and also invades other organs like the bladder, intestines, and sexual organs.
Living in really chronic, debilitating pain.
According to a 2014 study published in Human Reproduction, light-hued irises were more prevalent in women with this specific kind of endometriosis than any other color. Endometriosis typically affects women between the ages of 15 and 44, and the abnormal growth of tissue can lead to inflammation, scarring, and cysts. Although science hasn't quite figured out what causes endometriosis, there are some theories like genetics and reverse menstruation. If you experience really painful period cramps, irregular bleeding cycles, soreness during or after sex, tiredness, abnormal bowel movements during menstruation, and spotting between your periods, you may want to get yourself checked for this health condition. Some of the surprising things your eye color can tell you about your health actually involve positive news. For blue-eyed people, this also means a lower chance of certain health conditions like vitiligo and cataracts. According to a 2012 University of Colorado School of Medicine study, blue eyes, the same characteristic that predisposes someone to melanoma, can also be less of a risk factor when it comes to the skin condition vitiligo, which is a chronic autoimmune disorder that manifests as white patches on the skin and hair. Dr. Richard Spritz, director of the CU School of Medicine's Human Medical Genetics and Genomics program, explained, genetically, in some ways, vitiligo and melanoma are polar opposites. Some of the same genetic variations that make one more likely to have vitiligo make one less likely to have melanoma, and vice versa. If that isn't enough good news for blue-eyed people, there's more. Apparently, you might not need to worry about developing cataracts, at least prematurely. A 2014 study published in the International Journal of Ophthalmology found that those with darker eye shades were more at risk of developing cataracts. But cataracts are part of aging for almost everyone, so perhaps this isn't really the biggest win. If you or anyone you know needs help with addiction issues, help is available. Visit the Substance Abuse and Mental Health Services Administration website or contact SAMHSA's National Helpline at 1-800-662-HELP-4357.